Welcome to the Redbeard Embodiment Podcast. I am your host, Alex Green, and I'm on a mission to bring the power of embodiment to people all around the world. In this podcast, we explore how embodiment practices, trauma healing, and knowledge about the human nervous system can help us find our ground, discover new sources of meaning, and create connection in an ever-changing world. The deepest change is embodied change. All right. Well, I am so pleased to be sitting here with Dr. Eric Robbins. Dr. Robbins has been a colleague and a friend and a mentor over the years. Just to share just a quick introduction to Dr. Robbins, and then we'll jump into our conversation. Dr. Robbins is a urologist in a large medical partnership in Southern California in the LA area with a specialization in chronic pelvic pain. I intersected with Dr. Robbins through his work in the TRE, tension and trauma releasing exercises community that I'm a part of as well. And have met Dr. Robbins at conferences and watched some of his videos. He has a YouTube channel that we'll include here down below to watch some of his interesting videos. But Dr. Robbins, so glad to have this chance to sit down with you today.
Alex, thank you, and it's a pleasure. And the thing that my first introduction to you, other than meeting you in an advanced TRE class, was somebody told me that when Dr. David Berselli, who founded TRE, needed sessions, he came to you from time to time. So I said, this guy must know what he's talking about. So I'm so happy to be on with you.
Oh, well, I'm honored. Wonderful. Well, I thought what would be cool to cover, I mean, what I especially want to get to is you within the allopathic medical field, how you see stress, trauma show up within your specialization, and how you have found your way to mind-body practices like TRE, EFT tapping, block therapy, and some other things, and how you see that connection, what sort of these sort of alternative mind-body practices, what they have to offer to health in an overall sense. So that's kind of the big picture I'd like to go over.
Yeah, sure. And by the way, and all that stuff that you just mentioned has literally been my every waking thought for the past 30 years. So I'm kind of probably a boring guy if you want to talk about anything else, but
well, good. All right. Well, that's perfect. Then we're on your main topic of interest. So that's perfect. Yeah. Well, would you just share a little bit about your personal story? Like what led you into medicine? What led you into mind body, aspect of things? I'd love to just hear your story.
Sure. So I grew up in Houston, had kind of a fair amount of early developmental trauma, a lot of probably pre-verbal stuff. And, I guess when you're kind of stuck and locked and frozen, you don't necessarily even know that because like we all only know our own experience. But I remember I had my mother and my sister had chronic fatigue syndrome. And I remember literally every day coming home from school and my mom would be sick in bed.
Wow.
And, we took her to a bunch of doctors in the Texas Medical Center and they couldn't find really anything physically wrong with her. Sure. And she went to some psychologist who said, well, she's not crazy. So there's a huge bucket of folks, by the way, who fit into that category. And then I started maybe around age 15, developing a lot of chronic fatigue myself, a lot of depletion, a lot of exhaustion. It's difficult to make plans because someone says, do you want to do something Saturday? And I had the mindset, God, I don't know how I'm going to feel that day, a few days from now, or so my chronic fatigue persisted throughout college and got really bad in med school. And
did you say started at age 15? That strikes me as being on the young side, at least from my own experience. Is that?
Yeah. I mean, I think it probably was.
Yeah.
And persisted in med school, persisted in residency. I was at USC for residency, and did 2 years of general surgery and 4 years of urology. And call was like every third night. And a lot of those times we were up most of the night. It was just, again, I really don't know how I made it through. I mean, it just, it was really intense. And then, started out in practice. So I hadn't been in practice for too long. And I just got to the point, I just wasn't functional. I was collapsed physically. I had a lot of brain fog all the time. I was just not a nice person to be around. Linda would ask me to do stuff, my wife, and I just, maybe because I was so exhausted, I'm like, I don't want to do it. And she really had to make up a lot of the slack in those days. And so I remember in 1997, I went to a guy who was a bioenergetics psychologist.
Sure.
And those guys kind of specialize in the intersection of the body's kind of life force energy and psychology and stuff like that. So the guy told me back in 1997, I said, Bob, I'm collapsed in every possible way you can imagine. And he told me, Eric, you're getting by on 3%. And again, that really gave me some perspective, because I thought, does everyone feel like me? Does no one feel like me? And that really put me in perspective, like, gosh, like, 97% of other people have more energy. And so that started a kind of a long trial of healing to try and find out what's blocking my energy. Where is it? Do I not have it, or is it in me and locked up somehow?
Sure.
And that kind of got me interested in initiating energy healing, and then kind of the field of bioenergetics and Reichian breathing and TRE and tapping.
Could we pause for a second? Could you just, because, so in a way, by going to a bioenergetics therapist, you're kind of going to almost, in a way, one of the main beginning points, the pioneering methods for, somatic modalities. Could you just really quick talk about Wilhelm Reich or his body armoring, or just for our audience to get just a little context?
Sure. So kind of the model that those guys use is that, at any time in our life, particularly when we're young, if something happens to us at the time that feels terrorizing or overwhelming or just more than we can handle, typically we talk about the fight or flight response. But if something's happening to a little kid, they're probably not going to fight and do much. They're probably not going to be able to flee and get away. And so we'll freeze. And freeze involves a couple different things, but one of those is that the overwhelming emotions and memories are literally held in the body, locked into the muscles and the fascia, and that literally holds those emotions inside, so they're not coming up to our conscious awareness and bothering us. And another thing I think that happens when we go into certainly a freeze state, everyone talks about this, the rest and digest, ventral vagal, parasympathetic healing state, but there's a kind of another branch of the dorsal nerve that causes a dorsal vagal kind of an immobility shutdown state. And, I think what a lot of folks, and to be honest, most physicians don't realize, is that people can go into a high fight or flight state or a freeze immobility state. And for many of us, that'll kind of just stay on autopilot and keep running for the really years, decades. And, things like chronic fatigue, which I had, and the dysautonomias and IBS, you're either stuck in a high fight or flight or an immobility freeze state, and that just will persist. So what happened with me, when this bioenergetics guy told me I'm getting by on 3%, it didn't mean that I didn't have energy. My understanding now is that I had probably as much energy as anyone else, but it was locked in to these myofascial constrictions, and I was so bound up and tight that the energy, in essence, was just not flowing or barely flowing. And and it's kind of to unfreeze this stuff, to get the myofascia to release. Obviously, it's important to do that, but you have to go slow, because as the muscles start to release and open up, what may come up to our conscious awareness is the same overwhelming feeling, sensation, memories that cause us to freeze to begin with. And so it's a little bit of a dance, but I think that's really, for so many of us, the way out. I know you train in somatic experiencing and TRE, and both those are modalities of working with the body and getting us to release those patterns of freeze in the body, and doing it, slowly and safely.
In a titrated way instead of all at once, so that so it can be integrated.
Yeah, absolutely. Yeah.
Very cool. So that was 1997 bioenergetics. You got this idea that maybe 3%, and you got some insight into, what sort of needed, you then came to understand that it was a matter of, kind of working with this freeze physiology. And you tell whatever you're comfortable sharing, just a little bit about that process. Was that successful? Did multiple modalities help you do that? Share a little bit about what that healing process was like.
So, to be honest, for the therapist that I went to, by the way, was fantastic, and a lot of people consider him world class.
Yeah.
Looking back now, I honestly can't say how much those 4 years in and of themselves helped me.
Okay.
And I'll share with you kind of a hugely important learning that I developed during that stage, only because, I mean, again, it was nice to have someone to talk to and get in touch with our emotions. And the person was very supportive. We did do a little body work, but again, I can't tell you 4 years later how much it helped or not. And it was not till I did some other modalities that did help that I had some new understandings. And so one of them, there's a model that I share that I first learned about by Bill Harris. He used to run a big company called Centerpoint, and they had a product called HoloSync. It was a binaural beat and audio
Sure. Yeah.
technology
Yeah.
that
Yeah.
helped
Yeah.
me
Yeah.
tremendously. So Bill had a model that to this day, I think is very, very accurate in what we see and how people actually get better. So the model is this, that, everyone's heard that expression. People say my plate is full.
Mm.
And, everyone understands that, if you have too much on your plate, then it creates a sense of overwhelm. So for all of us, our nervous system's like a plate or a cup.
Mm.
And if life gives you more than you can handle, if you exceed the size of that neurologic stress threshold,
Mm.
that kind of creates this generic stress or anxiety reaction inside. And everyone copes with that differently depending on how they learn to respond in childhood. So some
Mm.
people isolate themselves. Some people are angry and pissed off all this time. Some people are anxious or depressed or engage in addictive behaviors. But all
Right.
those are secondary to getting, pushed over that threshold to having too much on your plate.
Sure.
Now, one of the things that we know is that particularly early life stressors and traumas affect our nervous system in such a way that you may have a very, very small plate.
Right.
And so looking back now, I can see that, I mean, I was getting by with my plate was the size of a thimble.
Right.
And so you can imagine life's going to fill that up awfully fast. And then you kind of go into these feeling like crap and have these dysfunctional feelings and behaviors. And, talk therapy. And I would say the therapist I was with probably did a much higher percentage of talking than somatically based stuff.
Sure.
Talking's good. You go in, you pour out the thimble, but 50 minutes later you leave there and my cup was still the size of a thimble. So
Sure.
the paradigm shift is, how would you get a much bigger cup or plate?
Yeah.
Because then you could handle a lot more coming at you from life without getting stressed out. So that Bill Harris explained that. His sound technology called HoloSync
Mm.
was a huge epiphany for me, because it was the first time I noticed my plate was starting to get bigger.
Got it.
And to put in perspective, I was getting by on 3%, and
Right.
over the years, I think started getting by on 15 to 20%,
Yeah.
which in the scheme of things may or may not be that big, but for me, I felt can handle 5 times more than I could
Yeah.
before. It
Much
was a
bigger.
massive thing. And I
Right.
wasn't locked into this global anxiety where I was just being triggered all the time.
Mm.
So that was the start of getting a bigger plate. The other thing that I find helps the plate tremendously is TRE, tension release exercises. I know we'll talk about that a lot later.
Right.
That also I found
Helped
dramatically increased the
expand
size of my plate.
that plate.
Absolutely.
Just briefly, I want to just throw. So I'm loving this. I haven't heard of Harris's work, but the analogy, what we talk about in
Yeah.
SE and other,
Mhm.
this concept of window of tolerance.
Yeah.
Sounds similar in this
Yeah.
idea of, window of tolerance is that zone within our nervous system where we, feel safe enough that we can
Mhm.
function with this sort of normal zones.
Yeah.
But I think you're right that there's been this insight, maybe in sort of the second or third wave of somatic work, the insight being that before we do really big, cathartic, abreactive type of work, that
Yeah.
we need to sort of evaluate what is the window of tolerance or the size of the plate. And there's so many strategies that done too aggressively, yet done consistently and with awareness, can help expand that
Yeah.
capacity or that plate. So I'm just really resonating with what you're sharing. That's
Yeah.
the first work. That's the most important work in the beginning.
Yeah. Exactly.
Yeah.
Yeah. That's why, there's so many therapies that are talk therapies or related to that, and there's definitely a place for those for sure. I think my opinion is most good long-term healing at least has to involve the somatic component. The bottoms up and a top down is probably the ideal combination for so many of us.
Yeah.
Yeah.
Yeah. Yeah. So for you, so you felt that, from 3% to 20%, and so it sounds like, that initial course of therapy, but then the holosync, the
Yeah.
binaural
Right.
music,
Yeah.
TRE was a big piece of
Yeah.
that.
Hmm.
Anything else that was important for your own,
Yeah. I
expanding
mean,
your capacity?
yeah,
Yeah.
I've been a long time meditator, which helps. And yeah, I mean, I've dabbled in some stuff, some myofascial releases. I learned about block therapy a few years ago, which is kind of a novel way of doing deep
Yeah.
myofascial release. Kind of the interesting thing about block therapy is that obviously all of us know where we hurt and where we're tight in our bodies.
Sure.
But you start laying on that the block therapy uses a wooden block. It's maybe a little smaller than a yoga block, and it's
Mm,
got rounded edges and smooth corners. And you'll lay on it. I mean, you may lay on it on your quadricep muscle, under your ribs, or
mm,
under your back, and
mm.
and you learn that there's a lot of pain that wasn't so obvious till you lay on this block. That it's a really nice, novel way of releasing these myofascial constrictions.
Yeah.
And I found that for me, that when because I've done TRE
Yeah.
since like 2014, and it kind of helped loosen up myofascia and then allow the tremors to move through my body even better.
Yeah.
And yeah, so it's been a nice complement to my TRE practice. And
Yeah,
it
yeah, well,
also,
yeah, and that's
yeah.
on my list because I want to talk about TRE, and I've seen your enthusiasm for block therapy, and I've tried it and I like it too, and I relate to it as a bodywork therapist as well, doing
Yeah.
that. So I want to get to that sort of what you know in a few minutes. I want to get to sort of what are some things that can deepen and amplify and work
Yeah.
together like
Yeah,
those things. But
absolutely.
let me ask you, just by way of background, because I saw at one point, this is a while ago, so I don't remember, but either you told me about this or I watched a video. But
Hmm.
if I
Hmm.
remember, I think that you were quite impacted by the research, the ACEs study. I think that was in the
Hmm.
late 90s or something
Yeah.
like that, a big CDC Kaiser Permanente
Yes.
longitudinal study. Could you share a little bit about uh, the ACEs framework, and also just
Yeah.
how you connected to that, being in the field of medicine?
Oh, absolutely. Yeah. That was another huge part of the puzzle. So, as you know, because I know you teach this stuff, ACE stands for Adverse Childhood Experiences. And so the ACE study was a study done in 1997. This guy basically correlated, depending on how many adverse childhood experiences someone had, he found this huge correlation between having a lot of diseases, early death, heart disease, lung disease, liver disease, neurologic diseases, chronic pain, the whole gamut of stuff years or decades later.
Right.
And as you know, the story goes, he had this data. Dr. Filiti had this data. He presented it at the NIH, and initially when he presented it, a lot of the attendees were so just aggravated and upset. They're like, there's no way these early childhood things could cause death and disease later on, and this is ridiculous. And I think they wanted to call security on the guy and have him escorted out.
Right.
The challenge is that the data was true, and now there's been several thousand studies written about the ACE study. So to me, though, what is important is this: if you know these adverse childhood experiences affect our health later on, then
Right.
you have to reverse engineer that and say, well, how does it actually do that? And so what these adverse childhood experiences do, it actually programs how our physiology is going to run for the entire rest of our lives.
Mm.
Sometimes it gives you a very small plate so that
Mhm.
you're triggered and going into stress physiology with all these little triggers.
Yeah.
I think it sets folks up so they're just really easily firing a sympathetic fight or flight state, that they're
Yep.
stuck in an immobility state, um, and that those physiologic patterns that will then run for the rest of our lives are what affects our health. And what I tell my patients, but again, this to me is not just an abstraction or a concept. It's actually
Right.
like when I was sick a few years ago,
Yeah.
a huge epiphany for me was when I realized in that hospital bed, oh, I'm stuck in a fight or flight stress physiology. I'm stuck in it. It's not turning off. I don't have a way to turn it off. I know because I'm a physician that there's nothing in standard medicine that turns that off.
Right.
And yet, even though you hear that in common parlance, people say the body tends to heal itself, it doesn't heal very well when it's locked into chronic stress physiology.
Yeah, it heals itself well if you can be in a baseline in a well-functioning nervous system. But if you're in stress physiology, it really impairs that ability. Yeah.
Yeah. And again, the key point that I tell patients, people literally, and this is obviously a simplification, literally get locked in a fight, flight, freeze. It's like an autopilot for so many of our patients. And I tell the patients, when you're locked in a stress physiology, there's a bunch of things that happen. There's the stress hormones sensitize nerve fibers and pain fibers. So I'm kind of a regional chronic pelvic pain dude. So a lot of times people with chronic pain, there's a lot of nerve hypersensitivity. With fibromyalgia, you touch someone that hard, they jump up. The problem's not, quote, in their head, but those nerves are exquisitely hypersensitive.
Yep.
You can, so often chronic pain, there's a lot of nerve hypersensitivity. Well, the higher level question is, why is that happening?
Right.
Frequently, it's because folks are locked in a chronic stress physiology.
Yep.
When there's increased levels of stress hormones, there's more inflammation in the body. And I mean, everyone knows inflammation makes everything worse.
Right.
The hollow viscera, the bowel and the bladder just don't work like they should. There's chronic myofascial tension. The cardiovascular system doesn't work. It affects the smooth muscle. It affects the immune system. So many patients come to us with chronic illnesses. And if you do enough of this work, you realize they're sick because they're stuck in a chronic stress state. And it's not just enough for the doctor to say, oh, Johnny, you're stressed. Mary, go take care of your stress. First of all, no one really knows what the heck that is. Or
what does that mean? How do we do that? Yeah.
How do we do that?
Yeah.
There are things that do work. We're talking about those right now.
Yeah.
There's a bunch of different strategies, but you want to find stuff that shifts our physiology and shifts us out of that state. And that's really where our work lies. And then I've seen people heal tremendously from the worst conditions if you can get them to that point where you shift their physiology and get them out of that autopilot.
Right. Well, so from your perception, from that 1997, NIH meeting, presenting that research, basically showing all these future health maladies, big correlations to how much stress and trauma in childhood, and there was this sort of sense of disbelief a little bit. What about now? I mean, now we're 25 years plus later. There's people like Gabor Mate speaking on some of these related things.
Yeah.
Robert Sapolsky doing the stress physiology research at Stanford. Has from your perception, being inside the medical field, has there been a lot of change around this concept over these?
No. Okay. There's unfortunately not. Again, I think people may be starting to understand this a little bit as an abstraction or concept, but that's far different. I mean, the place I'd say to start, I see a number of physicians just as patients, and physicians get sick, and I almost haven't met any that say, that understand this. God, I'm sick, and maybe it's because my physiology is off, and really putting it together in such a way that they want to find a way to shift their own physiology. So at this point, it's understood as an abstraction. It's interesting because we're all getting trauma informed now. That's a start.
Okay.
I think the pediatricians, when the kids come in for their 11 and 12-year-old visit, they're screening them for trauma. They're screening them for depression. Again, that's a huge start. But still, once you're trauma informed and you realize this little kid had a lot of trauma, it's affecting their health, or it's giving them ADHD, and they can't focus in class because they're locked in a stress state, and the brain is not going to their logical, rational, calm neocortex. They're more in this emotional, reactive part of their neurology. It's not letting them sit down in class and listen and learn. So we're starting to understand the problem more, but the what to do about it, there's still huge gaps in that. So we've got our work cut out for us, Alex, for sure.
Well, it sounds so. I would love to hear, because this I've been genuinely curious about. I'm not asking this just for the podcast because I don't know, but I'm so curious about in your practice, and I'm imagining, where you see clients in a treatment room, and I think you have a pelvic floor specialization, but it might be broader than just that.
Right.
I'm kind of curious, how does this? Do you do a lot of psychoeducation about these principles? do you, how is it that you help educate and empower your own
Right.
patients around
Right.
some of this stuff?
Right. So, yeah, I mean, patients get referred to see me from throughout like a region where maybe there's 5,000. I'm sorry, the size of the patients that we take care of in Southern California is about 5 million people.
Okay, wow.
And so
Yeah,
there's a lot of folks, that come in with chronic pelvic pain.
yeah,
Now, when folks come in, we always do the medical standard of care first. And so, for
right,
example, the American Urology Association has guidelines and tiers of therapy.
right.
Interestingly, the first tier for chronic pelvic pain and interstitial cystitis is you watch dietary irritants. But the second tier that the AUA espouses says stress reduction, and relaxation. I've just taken that, to the degree that most people have not
Right.
in the
For most
world.
people, it's a little bullet point that you
It's a
mentioned,
little, right. It's a blip
but
in
for
passing.
you,
Yeah.
it's there's a whole world to that.
Yeah. Because
Yeah,
I understand that they're stuck in a stress physiology and they're not going to heal as well till we shift out of that physiology. So if
yeah,
folks say, well, what are you doing? I'm like, listen, stress reduction and relaxation is the second tier. It's just we're taking that well beyond what most folks do. So,
yeah,
but folks come in to see me, and I'll do the standard tiers first, if those haven't been done. I'll
yeah.
give literally the spiel that I just gave you.
Mm,
Yes, you're sick. Yes, the pain's real, but at a higher level of truth, that's due to nerve hypersensitivity,
yep,
chronic muscle tension, and spasm.
yep.
There's a lot of reasons for that. Um, and in addition to standard medicine, I'd like to teach you some techniques that'll help maybe shift your body out of this fight, flight, freeze, stress state so
Got
it
it.
can heal better. And the
Yep.
folks that are interested, and I think I'm close to about 2,000 patients that I've taught in the office how to do it. I'll lay them down on my exam table. Actually, I'll get on the exam table first, demonstrate
You
it,
show them. You show
film
them.
me. Yeah, they get to film me. Um, they get up on the table. We do it. I do a very slow, safe method because a lot of the folks that I see, there's certainly a lot of chronic pelvic pain, but over the years, the people send me chronic fatigue and fibromyalgia. And there's a certain subset of patients that are real frequent flyers. They're admitted to the hospital frequently and for long periods of time. They've had $1 million workup. No one can really figure out what's going on.
Right.
And I'm starting to see some of those patients.
Okay.
And I'm certainly not helping or curing all of them, but we've helped enough that it's created a lot of buzz
Yeah.
in the med center and kind of in the surrounding region.
Yeah.
So yeah, I'll take them through TRE
Yeah.
because it's one of the best things I know to help shift folks out of that fight, flight, freeze, stress autopilot.
Can you give just, we keep saying TRE because we know so much
Oh,
what it
okay,
is. Could you give just like a 2 minute, 1 to 2 minute for somebody who doesn't just so
sure,
they know what we're talking about?
sure.
Yeah.
And again, if I may just kind of give the quickie spiel that I tell patients. So I'll tell patients, I'm sure you've seen on TV or YouTube before the lion chasing the gazelle, and most people have seen that. And I'll say, literally, that gazelle is running for its life. It's a life or death chase. What's interesting, though, is that the gazelle escapes and gets to a safe place, and it won't do this until it feels safe.
Mm,
Its body will shake and shiver and tremor. I
mm,
say every animal and every mammal and all of us have this built-in shaking, shivering, tremoring mechanism that does two things. Number one, it seems to turn off that fight, flight, freeze, stress switch. Literally, the gazelle will tremor and it'll go back and hang out with the herd and graze and take care of its young, and it's not kind of stuck in this PTSD type state that so many of us would be stuck in. We
right.
have a major trauma.
Yeah.
The second thing I like, I say 1 minute, if you think about it, I'm gonna lower my camera a little bit. 1 minute the gazelle's eating the grass, grazing, and
Mm,
then that cheetah creeps up, and
mm,
then bam, in half a second the gazelle's running 50 miles per hour and zigzagging, and it's like there's a lot of charge and survival energy coursing through its musculature.
mm,
And the analogy I give, it's like if I have a can of soda, you shake the can up. Now there's a lot of pressure in this can.
mm.
Obviously, we're not going to rip the lid off and spray diet soda all over my exam room. But what do? We just start cracking that lid and go.
Yeah.
We're releasing the charge from the musculature.
Mm,
It's the charge that's held there that keeps the muscles kind of chronically tensed.
right.
So the second thing that these tremors seem to do is starts releasing the charge, the survival energy that's locked into the musculature,
Yeah.
so it can calm us down and the muscles tend to relax over time.
Sure.
Can I share a really useful story. So
Please do. Yeah.
a few years ago, saw a few different younger women that had very tight spastic pelvic floor muscles. One woman had vaginismus, meaning she
Hmm.
could not introduce anything, including, a penis for intercourse in her vagina, that
Yeah.
it would just lock down. It was so tense and tight.
Yeah.
She was not able to be sexually active. The other one was someone whose pelvic floor was so tight
Mm.
that every single time she wanted to use the restroom, she'd have to sit on the toilet for 5 to 20 minutes trying to relax that muscle so the urine could flow with.
Yep.
Both of them, we did the standard urologic or gynecologic workup.
Yeah.
By the way, both of them, I asked these women multiple times, is there any history of trauma in your past? Because one thing I'm pretty sure about is that those muscles are locking down and staying tense and tight. It probably just didn't happen for no reason. Like our creator probably didn't look down and say, I'm going to pick this woman for no reason, make her pelvic floor spastic. There's probably
Right.
a reason for it. So
Right.
I asked them repeatedly. Neither woman had any recollection of any trauma that could be held in their inner pelvis.
Sure.
Both women, I taught them how to do TRE.
Yeah.
And as you know, Alex, the tremors usually start on those inner groin adductors, and so the legs start tremoring like this. And we
Yeah.
did a very short amount of tremoring, maybe 1 or 2 minutes.
Yeah.
What the tremors do is they're unfreezing the musculature in the pelvic area.
Mm.
Now I know, again, we talked earlier.
Yeah.
Something happens in someone's life that feels terrifying, stressful, overwhelming. It's too much to handle. It'll be those memories, traumas, emotions will be held in the muscles, locked in
Yeah.
to try and protect us. But I know that when we did a little bit of TRE, it's going to cause those muscles to relax, and what had happened might come up to their conscious awareness to be dealt with. So sure enough, after 1 or 2 minutes of TRE,
Mm.
both women magically remembered what had happened. One woman, the one with the vaginismus, had had a date rape in college.
Okay.
The other woman remembered something that happened with her dad,
Yeah.
when she was 7 or something.
Yeah.
And interestingly, one of the women, her mom wrote to me and said she's been in therapy for 3 years and we never knew about any of this stuff. So it came into conscious awareness. This is a classic example of how this works. Again, this is
Yeah.
not an abstraction or a concept. This is how it works in a clinical setting.
Yeah.
So both women, once they were consciously aware of what happened and were able to work through the emotions of it. One woman, I think we did EFT, we did tapping to
Yeah.
clear the charge off the memory. The
Yeah.
other woman wanted to go back to her therapist and process it. But
Yeah.
both women, the pelvic floor was able to relax and their problem was able to resolve.
Yeah. Such good and concrete examples. And
Yeah.
I'm thinking to myself, oh, I'm so glad. I mean, by the way, I've had good experiences with the physicians in my life, but the idea that you're doing this, that you're introducing this kind of work to your patients just is
Yeah.
moving to me. Just as a quick aside, we recently had a graduate of our TRE certification program. One of our online cohorts,
Yeah.
and her whole she is a woman who suffered from vaginismus herself, got some big relief and healing through TRE and other mind-body work. And that is her field. She works with other
great.
young women, or
Wow.
not young necessarily, women
Yeah.
with vaginismus. And TRE has become a really important tool for her doing that work. So
That's fantastic. Yeah, there's such a big need for that. We have a pelvic floor physical therapist who's really good and very skilled that works in our department, and she actually totally gets pain and gets the connection with trauma. So yeah, you find someone like that, they're worth their weight in gold, and they're few and far between. But yeah, that's great.
Can you talk a little bit? You have a reputation, even with one of your videos on your channel, is about how you work with sensitive nervous systems, because because you see a lot of that. And I'm thinking about TRE, introducing that tremor response that you explained so nicely and simply. And I know this analogy of the opening the Diet Coke bottle is such a good one. That's a good way to explain that. What anything more about sort of your approach around sensitive systems?
Yeah. So again, I was just, for our listeners who are not familiar with TRE, there's initially a set of six or seven standing exercises that we can do to kind of charge the body. And then we'll lay down on the ground and do a series of ground exercises to activate the tremor. So what I found, and I think what many of us have found, is the standing exercises are not necessarily necessary. 99.5% of people get great tremors just starting on the ground, which for me, I've kind of got size constraints and time constraints when I'm seeing folks in the office. So we'll lay them on the table, we'll do TRE. kind of going back to the example I just gave of these two women with tight pelvic floor muscles,
Right.
it does not take a lot of TRE to start unfreezing the musculature and have stuff come up to be dealt with very quickly.
Right.
And again, I think by the very nature of the people I see, chronic illness, chronic pain, autoimmune diseases,
Yeah.
I presuppose coming in that these people probably do have a trauma history that's put their physiology in that state and locked them up. That's my assumption. And because I know that what the challenge with TRE is not that it doesn't work, but that it works very well and very efficiently.
Yeah.
I'll start and I'll have people tremor for anywhere from 30 seconds to 2 minutes. And I want to see how they're doing. If they're not checking out or they're not, freezing, flooding, disassociating, we may go a little longer. But even, by the way, even a small amount of tremoring, again, as you know, really creates a profound relaxation response in somebody's body.
Yeah.
I think it was Dr. Berselli, who said, or no, it wasn't him, but someone said, you never know how stuck you've been until you've been set free. And we're really able to give people that experience because you do TRE with them. When they walk in the door, all they know their whole life has been their own experience.
Right.
You give them an experience of really shifting their physiology where they feel really relaxed and calm in their body, and their mind oftentimes is really slowed down. They're not having this flood of thoughts and worry thoughts.
Yeah.
And you're able to give them the experience, maybe for the first time in their lives, of, oh, there is a different way of being. And now I've got something to compare how I was with how I am. So you never know how stuck you've been until you've been set free. There's not a lot of modalities you can say that about. TRE allows us to do that pretty consistently. And again, we're setting a direction. Not everyone obviously is getting cured in one session, but we're setting a direction. Let's keep shifting the physiology back to a ventral vagal rest and digest state where they can heal.
Yeah.
Keep bringing them back there. Keep bringing them back there. And so and the other thing is, and again, I know if you watch Dr. Berselli's videos and a lot of folks on YouTube, everyone's whole body shaking and tremoring, and it looks great, and they're getting tremendous releases. And I think that's fantastic. And I think there's a role for that.
It also doesn't have to be necessarily that.
It doesn't. Yeah. If people get a little bit of tremors in those inner groin adductors, and it's maybe in the quads or the buttocks or particularly the psoas, they'll get a tremendous shift in their physiology. I could care less if it moves through their whole body. Again, there's a time and place for that, but there's so much bang for the buck. And people sometimes come in and they know I do TRE, and they watch the videos of people.
Yeah, they think it has to be like that.
Yeah, it absolutely is not. I'm 8 or 9 years in now.
Yeah.
And I get a little fascial tremors that I feel throughout my body, but I'm still get tremendous results just from inner groin, inner groin adductor tremor, and a little bit in the pelvis.
Yeah.
It's tremendous. So yeah, that's kind of my thoughts on that.
Yeah, I love that. I love that experience. I mean, I work with a lot of people, as the initial session and then later sessions, but there's this certain joy in somebody's first exposure. And I agree with you. Sometimes that's only been 30 seconds, 2 minutes, just that initial introduction of the tremor response. And then to hear sort of some of the comments, they'll stand up or they'll lay down and they'll say, wow, this is the first time my mind has stilled in this way. Or they'll stand and they'll say, wow, this is the first time I really feel my legs underneath my body. Or I feel a sense of safety that I almost never feel. And to me, that's what always pulls me back to TRE is that's such a small, a brief exposure can have that level of impact on somebody's felt sense and nervous system. It's really powerful.
Yeah.
Yeah.
I remember I had this patient one time, and the guy was a cop in a very rough part of Los Angeles, and I think he grew up in like foster care, had a lot of trauma. I remember we did a TRE session at him for the first time, and we finished. The guy was almost a little agitated. He's like, man, this feels weird. He goes, I don't even know what I'm feeling. I don't have a name for what I'm feeling. And anyway, we got this guy seated up and got his feet on the ground. And anyway, this feeling he didn't even have a word for was relaxation.
it was distressing for him. He wasn't
Yeah,
used to
exactly. Yeah, yeah,
that.
yeah. It reminded me of a quote from one of my teachers, Steve Parkhill, who said, security is not what feels good; it's what feels familiar.
Mm,
And so he really, but again, there's a direction we have to go in and get people to
yeah,
really heal, and that was the direction. So it took some time just getting him used to feeling that way, and
yeah.
he did tremendous after that too. But yeah, what a gift to be able to give people
Oh yeah,
just a feeling of relaxation when their life has been anything but that.
yeah. With your patients, after
Mhm.
you've gotten them started in the treatment room, are you
Sure.
sometimes giving them um, guidance around, doing it themselves, or
Yeah.
finding, do they work with you consistently? Do they sometimes work with other people? Do they, like, what if somebody gets a big impact? How do you
Right.
sort of guide them into where they might go with it?
Yeah, so most of them I've had them videotape me on their smartphone,
Yeah.
and I give them typewritten instructions, and I'll just say reach back out. I wish I had the luxury of seeing them back. It would be fantastic, but I just don't.
Yeah.
It's a really busy surgical practice, and these appointments where I see these folks they're typically 1 to 3 times a week, and like at 11:30 slot where I can work through lunch, or the 4:30 slot where I work through dinner. And
Hmm.
so for 15 years, my wife has known a few times a week I'm going to be there late, and
Hmm.
I'm fine doing that. But yeah, I don't. They're very limited appointments, and so
Okay.
I'll give them instructions. Some will reach out and tell me how they're doing. I encourage that, actually. They
Yeah.
can email me.
Yeah.
Yeah, I would love more than anything to have the ability to see them back, and a handful I can, and also a number of them are coming from long distances. They're maybe coming
Sure.
from, yeah, 2 hour drive or something.
Sure.
So
Well, before we started recording, you were talking about, someday you'll retire, and I'm wondering what, I wonder if you'll really retire, or if you might, if you there may be some TRE and other stuff in your quote unquote retirement era.
yeah, no, for sure. Yeah, teaching, I would love to teach TRE.
Yeah.
And interestingly, before the pandemic, we were teaching pretty big classes at our medical center.
Yeah.
It was primarily medical folks, and we sent feedback forms out to these guys, and the most common word we got back to describe their experience with TRE, you know what it was? It was the word hope.
Ah.
It's like I just have hope that, as you said earlier, something feels different in my body. Like I'm just not stuck.
Yeah.
You get to be a certain age and you kind of get into your rut in life, and you kind of can feel stuck. I mean, as I think about retirement, like,
Yeah.
you know, and to just have hope that I'm different, or I can feel different in my body, or I have an expanded awareness, or maybe more choices available, you know,
Mm.
that's I love that word, actually.
That is a great word. It's funny. You and I haven't talked about this much, but during the pandemic, I mean, it just goes without saying the crushing impact on the medical staff, nurses,
Yeah.
doctors, everybody
Yeah.
involved, let
Mhm.
alone just the general population. But with your son Jonah, through a connection originally through you, we had the opportunity of doing a multi-week experience
Mhm.
with Providence Healthcare System in Oregon,
Mhm.
training, just leading TRE for the staff, and
Yeah.
this was sort of just after the big impact from the Omicron wave of winter of 2021. But to me, it was probably just a drop in the bucket. But it was
Mhm.
also like, wow, what a useful tool, not only for patient level, but for people who are, healthcare providers who are seeing such high nervous system demand.
Yeah.
So that was a cool thing, but it's also something I'd like to see more of. Have you given any thought to what role TRE as a nervous system practice might offer the, physicians, nurses, medical staff in general?
Yeah. Well, so first off, I agree with you wholeheartedly. There's a tremendous amount of burnout
Yeah,
in the medical community. I would say almost every one of our primary care folks, ER docs, hospitalists are all planning to retire at 58. Our my organization allows an early retirement. It's one of kind of the last golden parachute.
sure.
To give you an idea, though, I mean, I know there's one guy who made it to like age 60, and everyone's like the grizzly old guy, pushed through. But Yeah, it's they're all planning to go out at 58 and tremendous burnout.
Yeah.
And yeah, I mean, so yeah, I mean, I haven't given thought to it. I'd like to get some classes going again. I worked on a COVID ward for a week
Mm,
and was pretty stressed out just hearing about the numbers that we might get early on
mm,
that, knock on wood, didn't
mm.
manifest to that degree. You know, they taught us we might have 400 people on, ventilators when COVID was first coming out. We had
Sure.
like a 14-bed ICU, so if you can
Yeah.
imagine, it was kind of going to be an all hands on deck
Yeah.
thing.
Yeah.
But yeah, the medical field's burnout. I think TRE is a great way to shift that. Um, yeah, I agree with you. I kind of wish I'd stepped up and done more of that in my own group. The thing is, they're trying to kind of, up till recently, they were trying to limit having big groups together, big meetings. But
Right. That's true.
yeah,
Yeah. Yeah. Yeah.
yeah,
Yeah. Well, yeah. I mean, I guess what we tried, our experiment was, virtual. I didn't travel, Joan and I, we didn't travel there, but we did
yeah,
it. And some people did it at the office, some people did it in their homes. And those, not everybody stuck with it, talk about a busy
yeah,
lifestyle.
yeah.
But those who did just reported a, really significant, benefit for regulating their stress.
Oh, yeah, yeah, absolutely.
Yeah.
Yeah. I would say, I mean, there's probably is a hierarchy of how effective things actually are for down regulating the nervous system.
Sure.
In my opinion, experience, TRE is way, way up there.
Yeah.
I think you get a lot of bang for the buck.
Yeah.
I think it's based on animal physiology. I mean,
Yeah.
so
Yeah, yeah. I
yeah.
like how you put that. Could we talk a little bit, earlier we mentioned block therapy,
Mhm.
and this idea that, another, something else that can help with this, stuck energy or the freeze physiology or the body
Yeah,
armoring from a Reichian perspective, that working with muscles, not only for things like pain. I mean, of course,
mhm,
it's important to, massage and all these things
mhm.
help with that. But to me, almost there's a something else beyond just sort of comfort and pain, which is liberating, we could call it life energy or restoring the, growing the plate or the,
Yeah,
using your analogy about the window of tolerance.
yeah,
But yeah, I'd love to hear what you have found with block therapy and how that
yeah,
contributes to people's wellness.
yeah. So I think that all of us have areas in our body of chronic kind of myofascial tension and constriction.
Yeah.
I think that, by the way, I have delved into qigong and Chinese medicine and co-authored a couple books on energy healing. And I think the biggest thing that blocks the energy flow in the meridians to begin with is these areas of myofascial constriction in our body. So it's worthwhile spending some time releasing that. What I liked about block therapy is that she's kind of got Deanna Hansen, who developed it, has kind of an order and sequence that she has you release stuff. Like there's some general body releases. Then she likes to release stuff like in the lower legs and calves.
Mm.
And Alex, as you may know, Alexander Lowen, who
Hmm.
developed the field of bioenergetics, used to say kind of developmentally, like the earliest traumas are held in the feet and lower legs and calves, and that energy is not flowing up. So we made it even feel grounded if the
Mm.
energy is locked up there. So
Mm.
Deanna never studied bioenergetics or really any somatic psychology, but just intuitively, she realized start releasing kind of down in the lower legs and calves first,
Mm.
then the upper legs, and getting the energy moving through. And I think Alexander Lowen would say the more that energy moves through our legs, we truly do have a sense of groundedness.
Mm.
And I actually wouldn't mind, every holistic person in the world uses this term, metaphysical grounded. I, until a few years ago, didn't really know what it meant as a personal experience. So grounded means you can feel yourself, you feel safe in your body, you you know kind of what's yours, what thoughts and emotions are yours.
Yeah.
Because so many of us, especially if you're sensitive or highly sensitive,
Right.
a lot of the thoughts and emotions we may experience may not be our own. I mean, that
It's
ran my
coming from
life.
the field, the relational field around
It's
us.
coming from elsewhere. In fact, I remember Richard Bandler, who was one of the co-developers of NLP, said,
Uh,
oftentimes a lot of the thoughts and emotions you're experiencing are not your own.
mm,
So to kind of have more of an energetic container,
mm,
what's yours, not as affected by others,
yeah.
is really a huge thing. And so that again, that's a concept, but opening up the energy channels, particularly in the legs, actually enables you to do that and to actualize that, in my experience. So anyway, block therapy releases these deep constrictions. Another thing that I think, to get the body to detoxify, it's much easier to do that if you release these patterns of constriction. Almost no one, I think, is, no matter how uh, viscerally in tune you are, I think almost no one is fully aware of how much we're stuck until you do some sort of myofascial release like this
Right.
and
You
find
don't
these
know until
areas that
you
you didn't
feel it.
know.
Yeah,
You don't
exactly.
know until you know, like, damn, I wasn't hurting here, but you lay the block there and you really feel how stuck you are. And then you feel when you're released. Yeah, but I noticed I was able to detoxify a lot better. I remember I
Nice.
used to get flus, like if I had an influenza,
Yeah.
and my whole body, I mean, people have a variety of symptoms, a cough and cold, runny nose, and GI symptoms, but for me, the myalgias were just horrible. My body would hurt so much. And I noticed after doing block therapy and releasing a lot of that, I get sick a lot less often. I recover a lot faster. And
Hmm.
it's almost not part of having muscle aches is way lower down on just the ways that a flu kind of affects me. And I feel
Yeah.
like because I'm detoxifying that stuff to some extent.
Yeah, I mean that so it comes up a lot in when I do manual therapy work with myofascial release structural integration, that detoxifying element or sometimes we may call it a healing crisis, or
Hmm.
your just where there's flu-like symptoms is so
Yeah.
common. Sometimes even without, I mean, we see that with TRE sometimes too, if somebody
Yeah.
overdoes it or when
Hmm.
it's new for them.
Hmm.
As their system is adjusting and changing, we can see a lot of that. Um, I'm curious for you. Well, to me, there's what I think seems really cool about block therapy, and I'm wondering if you agree. Is like TRE. What's great about it is, well, with TRE, there's a lot that can be done in facilitated work. So there's beautiful stuff that can happen in one-on-one work or
Hmm.
classes. So that
Yeah.
relationship can be really nice. But for many people, they develop a self-practice. And, I tell a lot of my people, like, this for, many of my folks, this is now a tool that they might use for the rest of their life when they feel
Yeah.
that they need it. And it strikes me that there's something similar about block therapy in the sense that, sure, you can learn the sequence, you could take some classes, you could probably get some really good information, but it also then becomes something that people can do themselves. They don't have to go into the body
Yeah.
worker's office, and
Right.
so as a part of a self-care complement, it sounds like it could be a big deal.
Yeah, it is. It's a really good, she's got like a monthly membership, and she's got just a ton of classes,
Mm.
releasing everything from the pelvic floor to I mean, just the whole body. I mean, it's a great series of class, but you're right. Once you kind of know the routines, you can absolutely do it on your own.
Mhm.
I remember we last February we had to travel to Maui for a wedding, and I had a fairly limited amount of stuff I could buy because I mean, that I could bring in the airplane. And
You
I
brought
said,
your
it's going to be
block.
something of the block. And I brought that damn block. And even funnier thing is, a few years ago, I would bring the block, and the TSA would always, they'd see the thing in the x-ray, and they'd always search it and search me. Now they just see the block. Oh, we recognize that. They let it go through. So
Okay,
I
well,
was telling Deanna
that means
when the
other people are
TSA,
bringing their blocks.
yeah,
Are
when the TSA guys are starting to recognize the block and not thinking it's like a block of, cocaine or whatever. It's like, that's pretty cool.
Oh my God, that's awesome. Well, so uh, circling back to your pelvic floor
Yeah.
specialization, and I'm thinking about myofascial release because I know that one approach to vaginismus, chronic a pelvic floor pain,
Mhm.
some of it is sensitive manual work. I think pelvic PTs do that.
Yeah.
Uh, Gynecologists, urologists might do some of that manual work, I'm
Yeah.
thinking. But my curiosity is, do you think that well, I'm a little bit, I guess I'll a little bit tease my own belief, but I want to see if you see it
Mhm.
differently or not. My own view when it comes to myofascial release, and TRE, to be honest, is that when we work with the system as a whole, if we kind of clear out major areas of blockages, that's sort of another way to create capacity within our myofascial system.
Mhm.
And that sometimes sort of kind of getting the low hanging fruit, like, somebody's, big myofascial patterns in their gluteals or their back. And if we can start to create some slack there, that sometimes that has a benefit on some of the more specific areas of dysfunction. So I guess what I'm getting at is, do you think that with something like chronic floor dysfunction, they may need some targeted work there, but would they also benefit from broader work to sort of work with the whole myofascial system and then some specific work? What's your thought about that?
Yeah, I agree. I mean, there's room for specific work, and the block, by the way, will do a lot of that. I mean, have
Yeah,
you ever tried sitting on a block and having kind of edging it in between your sits bones and your perineum?
sure.
Almost all of us hold a lot of stuff there, by the
Yeah,
way.
yeah,
I think there's a range from the general to the specific. Both is useful.
yeah,
Um, the other thing I was going to say, as far as increasing capacity, block therapy is a great way of releasing the musculature or the myofascial contractions. Sometimes it tends to come back maybe a little faster than I'd like, and I think that's where something like TRE combines well with block therapy, because for some reason with TRE, if we're able to get the tremors into a part of the body, it does seem to kind of unwind those myofascial tension and bracing patterns. So it's a little bit less likely to keep recurring. So
right,
that's why the two were a good combination for me. Block was not necessarily as standalone of a therapy in my experience as
right.
TRE,
Yeah.
but use block, show you where you're stuck, help to loosen it, let some TRE tremors go through there. That's
Right.
a really, really good combination.
A good combo. Well, it's almost like looking at both the mechanical and the neurological
Right.
intersection, because
Hmm.
some of what is sustaining muscular spasms, myofascial. So some of it is mechanical. I mean, there's muscles that are contracted. There's myofascial tissues that have densified or even gotten
Yeah.
dehydrated. And so, manipulation, whether that's block therapy, foam rolling,
Mm.
massage, can help temporarily open up at the sort of the physical level.
Right.
But I'm of the same view that TRE is kind of comes in at the neuromuscular level or the neurological level. And
Right.
so if an area is opened up and it's shown that there's a different movement pathway, if it can not only be released but
Yeah.
also feels itself in
Hmm.
relationship to the rest of the structure, I
Yeah.
think that helps probably train the brain a little bit around
Yes.
sort of showing, hey, there's this, you have a habit, that's fine. Let's open up a window into a new possibility, sense what that's like. I
Hmm.
think it makes it more likely that the brain sets up the conditions to not go back to its habitual pattern around, tensing and things like that. So kind of working at that physical and neurological intersection seems really important.
Yeah. Beautifully said. I agree 100% with that. Yep.
Yeah.
And that's what we're seeing clinically too. So yeah.
Very cool. Wow. Well, this has been so exciting. I've wanted to have this conversation for a while. It's planting seeds of future conversations I might invite you into
Sure.
if you're so willing. Anything else you want to share just by way of closing?
What I want to share. I was just in this, as I was sharing before we went live, I was in this global energy healing summit, and I was told, 100, 150,000 people may be watching it. And then I'm getting a tremendous number of emails now, just from people that have seen it. So for folks that do TRE, I don't have time right now to do individual TRE. So I usually, Alex, send my folks to you. So please, include your contact information in this, because certainly if folks hear about me and they're interested in doing TRE,
Yeah,
I don't have the time right now to do individual sessions.
sure.
One last thing I just wanted to make a quick plug for is that there's an organization run by Dr. Kathleen King called Primal Trust. Her website is primaltrust.org, and she's got a system that really explains the nervous system and the polyvagal model, and some. Her school focuses both on top down as well as bottoms up.
Great.
She started out with limbic retraining, and they teach a lot of these stuff. It's a good model for patients with kind of a complex illnesses, chronic fatigue, fibromyalgia, chronic Lyme,
Right.
multiple chemical sensitivity, POTS. So her organization very much resonates with what I do. And so just for folks reaching out, they kind of like the body of knowledge that I do. And
Right.
since I don't have my own school or any products, that's a nice place for that information too. And I
Yeah,
want to thank both of
we'll
you guys
include that.
for being in my life, and it's
Yeah.
great to have colleagues I can refer folks to and that I trust a lot. So thank you, Alex.
Oh yeah, well, thank you, Dr. Robbins. Yeah, we'll include that information. That's her work in that school. I haven't looked into it yet myself,
Yeah.
but maybe that will be another conversation we might be able to explore. So
Yeah, she could bring a lot. She'd be a great person to interview. She's terrific, extremely bright, and she's done her own work.
right,
She had, I think I was telling you earlier, her A score out of a scale from 0 to 10 was like a 9 or a 10. She
yeah,
really had a rough
yeah,
upbringing and has prevailed and is just doing
yeah,
great.
yeah. Thanks for listening to today's episode of the Redbeard Embodiment Podcast. To learn more, visit us at redbeardsomatictherapy.com or send me an email at alex@redbeardsomatictherapy.com. If today's conversation resonated with you, help spread the word by subscribing and sharing with others. Hope to see you next time.